So the DHS secretary said on Tuesday during the hearing that any possible Medicaid cuts would be catastrophic
Yeah.
for the hospitals. So if PA does lose that funding, it's more than $28 billion from the federal government that comes in here. How does the Commonwealth plan on protecting Pennsylvanians, the people themselves, and also the health systems here in the state?
Yeah, well, let me answer directly, but first I want to just set the table here so everybody understands. About a third of the funding that the Commonwealth outlays to provide health care, make sure we test our drinking water to make sure it's safe, things like that, that money comes from, about a third of it comes from the federal government. And this has been a relationship that's lasted for years and years and years. And by the way, this is not unique to Pennsylvania. This is how it works in other states as well. You cited that Pennsylvania gets about $30 billion in money to run our Medicaid system from the federal government. That covers 3.2 million Pennsylvanians. By the way, there's 13 million Pennsylvanians. Over 3 million of them are on Medicaid. Medicaid covers everything from your prescription drugs to paying for a wheelchair to, of course, your hospital visits when you're sick. And in Washington right now, the Trump administration is pushing forth a budget that would slash Medicaid. So apparently they can give tax cuts to wealthy folks. I'm not against tax cuts. We've cut taxes together 5 or 6 times for small businesses, for seniors, for families who are trying to afford childcare. But the idea that you would cut health care for poor folks, cut health care and place an added stress on your insurance premiums or on emergency rooms across Pennsylvania, across this country, makes absolutely no sense and is cruel and would hurt a whole lot of people. I'm hopeful that the Congress of the United States will actually listen to people who have been rising up and speaking up about how devastating these cuts would be. It would kill a hospital like Temple. I mean, they rely so much on Medicaid patients and the funding that comes from Medicaid. Your specific question was, how will the Commonwealth fill that gap? I don't know that we can. This is a deal that the Commonwealth and the federal government has made over years and years and years, applies in every state. And you can't be in a situation where the federal government pulls the rug out and says, hey, you're losing $30 billion, or you're losing a portion of that $30 billion, go figure it out yourselves. It doesn't work that way. The federal government made a deal to cover health care, and if they walk away from that deal, it's going to have a devastating impact. I've heard members of Congress in Pennsylvania embrace the president's vision here. Hell, they voted for the budget resolution last week that begins the process of cutting Medicaid. I don't know how any Pennsylvania congressman could vote for a budget that takes health care away from their citizens. And understand, of the 3.2 million Pennsylvanians, they don't just live in Philly. They don't just live in a different county. They live all over our Commonwealth, in rural, urban, and suburban communities. These members of Congress are going to have to think long and hard before they cast their final votes to slash Medicaid, because it is going to have a devastating impact on Pennsylvania.